For one Des Moines doctor, the impact goes beyond the exam room. And for many of her patients, they simply seeing her can make them feel more at ease. In tonight's Project Community, KCCI's Olivia Tyler introduces us to the woman who is one of a few in her specialty in the state.
I'm booked at about 5 months out.
Dr. Wanakee Carr is one of Iowa's only Black OBGYN physicians. In most industries, that's a sign of good business. But
when I'm one of few, that means people are going to have a longer wait, especially in the state of Iowa. If they don't feel comfortable seeing someone who does not look like them, that could lead to a delay in care.
Which she says could lead to more complications and even death.
They deliver there before all that.
Carr is a Des Moines native and went to medical school at the University of Iowa.
I've known I wanted to be a doctor from a young age.
But she wasn't sure what she wanted to specialize in until her third-year rotations.
I delivered a baby like my first day on the OB unit and I was hooked. So
a moment that has stuck with her since. Now, her presence is sticking with her patients.
When patients would come into the room like, oh my gosh, like I can let my guard down and really talk about maybe their fears. Especially once I got here, I kind of realized how much responsibility I have in this role to Black and brown patients alike. All right, well, we're gonna go ahead and measure your belly and then we'll listen to heart tones with the ultrasound today.
Carr did her residency in Kansas. She could have gone anywhere in the country, but she decided to come home, first practicing in Davenport and now at the Iowa Clinic in West Des Moines and Ankeny, where she's been for 4 years.
I never saw myself. I never had a Black physician when I was growing up.
She came back in part because she didn't want others to feel how she's felt.
I can proudly count on both hands how many minorities, let alone Black people, were in my medical school class coming through.
Dr. Carr is confident, but even still, after practicing for almost 8 years, she's not always sure how sure people are of her.
When you walk into the room, sometimes in the back of your mind, you're going to think, is that patient okay with me seeing them? Going through that has made me stronger and a better doctor because I have to prove every day that I am a good doctor, right? I have to prove every day that I'm more than competent to be here.
And she proves it in more ways than one. Carr is the board president for the Des Moines chapter of the American Heart Association. In the role, she educates the community on when to seek care and pushes for change at the State House. She's also the Early Career Fellow for the American College of Obstetrics and Gynecology, where she advocates for patients and physicians to have access to what they need.
Some of the legislature that's come through our state in the recent years from the obstetrics point of view has been harmful to keeping OBGYNs in our state.
In rural Iowa, clinics are struggling to keep their doors open due to lack of funding, forcing women to drive to the state's metropolitan areas for care. According to the American Medical Association, Iowa ranks at the very bottom of the list for the number of OBGYNs practicing per capita in the country. Dr. Carr believes Iowa's politics discourages minority physicians from moving here at a time where she says the state needs more healthcare providers in general.
Anything that we can do to increase the number of qualified obstetricians and gynecologists around our state is going to be helpful for everyone.
Until then,
do you feel like there's pressure on you to sort of show up for everybody?
A little bit, yes, but I'm okay with that pressure. A little bit of pressure I think is good.
Because though the long hours are tough, Dr. Carr says caring for the women of Iowa make it all worth it. In West Des Moines, Olivia Tyler, KCCI 8 News, Iowa's news leader.